Now, Limpopo province is reeling after 13 mine workers from the Marula Platinum mine outside Burgersfort tested positive for COVID-19. This has taken the number of COVID-19 cases at mines in the province to 20. The provincial government has in the recent past flagged the mining sector as a worrying COVID-19 hotspot.
Limpopo Health MEC Dr. Phophi Ramathuba says the 13 are part of the 130 employees who tested when they returned to the mine this week. She says the number includes health professionals as well as underground workers. Ramathuba says they expect more positive cases from the Marula Platinum mine as the test results of other mine workers haven't been received yet.
Before we accept them to the mine, we must take them for screening and testing, and that exercise is the one that has yesterday given us the 13 have tested positive. We have not received the full results of the 130, so we must still expect more.
The province is concerned about the rise in the number of mine workers who have tested positive for the deadly disease.
The only problem that we encountered with them is the reluctance to quarantine those people who comes from outside the province. But we insisted that they must quarantine everybody who comes from outside the province.
Limpopo currently has 76 COVID-19 cases and 3 deaths.
All right, you heard her there to discuss. We're joined by the MEC for Health in Limpopo, Dr. Phophi Ramathuba. Doctor, thank you for being with us. So 13 mine workers, just one mine testing positive. There was an understanding that more tests would come in. When will we get a clear picture of how bad this is?
Evening, Francis, and evening to all your viewers, and thank you for inviting us. As a province, we cannot exactly tell you when are we going to receive all the results of the total 130 mine workers that have been tested, because of, you will understand, the challenges that we are facing, not just as government, but also within the private sector in terms of testing capacity. We are still dealing with a number of backlogs, so you will understand that 130 is not a small number to can collect specimen and test. So we can't guarantee you, but we are in contact with the service provider, the private laboratory that is busy conducting the test, and on a daily basis they are briefing us and updating us as to how far are they. But what we can reassure you is that the close contact of the current mine workers who have tested positive, we've already, starting with from today, this morning, collected some specimen from them, and through our National Health Laboratory Services, the mobile testing unit, we have already started to test those ones that we have received the specimen this morning.
Okay. Is it clear what happened at this specific mine, how the infection spread? Because apparently among those 13 are health workers as well.
What we have not yet come up with the conclusion. The HOD was busy also with the mine up until now, late this afternoon. What we can indicate is to say case number 6 from Spukune area. It's one of the contract miners who came back from Eastern Cape, and he was amongst other contract workers who were tested, and he tested positive. And what we are also suspecting is to say where they were residing. I think all these mine workers are residing, I think, around the same area where they have been close contact with each other. And we see this as a mixture of community transmission with the inter-provincial transmission, because 2 weeks ago they started coming back from their different provinces, and when they arrived, the mine had its own policy to say everybody would be screened. So from the 17th to the 20th of April, the mine had screened around 2,700 employees, of which those who met the guidelines for testing were tested, and nobody came out being positive, because the 2,700, when we trace them, they are people residing from the local area, and these are the people who were already, some of them, screened through our mass screening and testing campaign during the lockdown of level 5. Now, these current ones are the 130 who only presented themselves to the mine on the 6th of May, and that's when the mine decided to say, because you have not gone through the process, we will take you for mandatory testing. Now, they've already interacted with those other contract workers whom I've already indicated. Some of them had tested positive and were already under isolation. So you can guess to say probably those who, there could be a super spreader who is case number 6, because the doctor who has screened or attended to the very same case number 6 from Skukune is the one that has already tested positive, together with her staff within her practice where she is working, because she is an occupational health specialist. So where she is practicing, even her staff also tested positive, and even the clinic, within the clinic, the mine clinic where other mine workers were being tested. So you are dealing with, of course, probably one super spreader who came in, infected quite a number of them.
So this is the classic cluster case that we're worried about. So right now there's this Marula mine, which I understand belongs to Marula Platinum. At least 13 workers there infected, maybe more. Are there any operations at the moment, or has that ground to a halt?
What we have been reassured by the mine, which of course we are now working closely with the Department of Mineral and Energy, I was also discussing with the DG this afternoon, is that currently we don't have active operations in the mine except the essential part, but also to say the mineral and energy will be able to guide us to say what needs to be done in terms of their operations and their regulations. But the other issue which gave us comfort as the department was that these 130 that has been taken for testing, they have not yet been accepted in the mine. The ones that were accepted, it's the 2,700 that has gone through the screening and testing process. But these 130 are the ones who have not yet gone underground. But we want to see all of them being quarantined, and those who have already tested positive being isolated, which we have already done that, so that we can monitor them to see those who are positive, if they are not developing any symptoms or any severity of the illness, then we'll be able to admit them in our hospitals and provide them with the correct management.
Yeah. MEC, the final question. So you say they haven't been admitted to the mine yet, but we know that mine workers often live in close proximity in those mining communities. I mean, is this a quandary for the province going forward? Mine workers do wear protective gear, but they're in lifts together, they live close together, they work closely together. Are there ways to mine safely? Can it be done?
It really can be done because the trick here, Francis, is your quarantine here. When everyone comes back, quarantine them for 14 days in your facility. And when you know that after 14 days they are clean, you can take them underground. Put up some infrastructure where you can accommodate them. They must mine in your mine, and at the end of the day, stay within that facility. If you do that, then they will not risk to get infected from the community. And as such, you can be able to be productive. And that's what we are really advising, to say, let's invest on proper quarantine facilities, rather than thinking we are going to invest on testing. Some of those contractors who came with the other contract worker might have tested false negative, and we have allowed them to go and work because the testing is also dependent on the timing. So had we quarantined everyone, we would have been sure that here we are dealing with all the workers who are free from COVID-19.
All right, we have to leave it there. Thank you very much, the MEC for Health in Limpopo, Dr. Phophi Ramathuba.